What's been interesting, what was interesting over the last year is that, where we had unionized healthcare workers, we were able to be prepared early, very early, for Ebola response. Our workers were able to reach out to other members of our union and say, you know what, let's take the best of our occupational safety and health and get trained before it even gets here. And let's make sure we share those resources across the world. So before we had our first case in the United States, we had trainings, we had seminars for all healthcare workers, not just the doctors or the nurses, but everyone who was a member of our union. And when we did have our first case, it was striking that the unionized healthcare workers were prepared, were calm, were educated, and were educating and preparing their comrades as well. And so the implications for this globally, and also understanding that, where we have public hospitals, where we had public funding, people that were, the mission was to take care of the public. That was absolutely critical. We're concerned about privatization. We're concerned about looking at the differences between what happened in the response in different hospitals in our country. But what was clear is where we had solid public health infrastructure, unions, healthcare workers united and educated, we were stronger, we were safer. And that is a lesson for the world. That is a lesson globally on how we should unite together around public health, supporting, shoring up, unionizing, and listening to and respecting all of our. One thing that's very clear to me as a healthcare worker, as a physician, and to all of our healthcare workers in the union is that Ebola is not an African problem. So it was so important for all of us to stand up and say, with climate change, with everything that's going on in the environment, with our, global economy where we go back and forth, we move back and forth, our families move back and forth, that we look at every health concern, health crisis as a global concern and not use it as an opportunity to place stigma or to marginalize people. So I was proud that our union worked with our public health departments in New York to get rid of the stigma, to say it's not appropriate to separate people or to call it, African disease or a black disease. These are all just crises that we have in humanity, and together as unionized healthcare workers, we can be prepared, we can eradicate, we can be stronger, and we can get rid of those ugly stigma that separates us. So I look forward to continuing to work with PSI and SEIU internationally so we can have a stronger global response and be stronger for all workers together.